great. Thank you very much indeed. And thanks for inviting me here. I'm very happy to talk about this topic. Brendan Kelly is my name, a psychiatrist. And I'm going to talk a little bit about eco-anxiety, which, it's defined as a chronic fear of environmental doom. And, I remember one of my parents telling me when I was worried about something, they said to me, "You are undoubtedly right to be worried, but you're worrying about the wrong thing, almost certainly. Negative things will happen, but not the ones that you think." So I'm forever being asked about the pandemic of anxiety in society today. And, there is no pandemic of anxiety in society. Every generation believes they're uniquely anxious and stressed, far more than the previous one. And the problem with eco-anxiety is probably there isn't enough of it. And the things we worry about, we don't distribute our worry logically. We worry about all kinds of things to avoid worrying about the environment and what's happening. It's a protection mechanism. Anxiety can be pathological and disabling, or it can be adaptive. If I wasn't a little bit anxious about this evening, I wouldn't have done any preparation. And contrary to appearances, I did some preparation. But that's motivational. But how can we change either the denial or the excess anxiety into something that's useful? There's a really nice paper called The Psychology of Climate Anxiety, which is free to access. And it describes a very particular excessive anxiety condition with anxiety, panic, loss of appetite, irritability, and that this extreme anxious state about the environment is more common among the young, climate scientists and activists. In other words, the very people who are probably already doing their best to address this are the ones most worried about it, and the rest of us who are not doing our best to address it, we're not worried enough about it. So you've got this exactly inverse distribution of anxiety, which is problematic. And it makes the really interesting point that a culture in denial is making all of this worse for everybody. So we have a lot of information about what to do, and some really nice information this evening that is more actionable and practical than one might normally hear. So that's really, really good to hear from everyone. But why don't we act? Sort of psychologically, there are various reasons for this. We have what might be called a faulty alarm hypothesis. We don't worry about the right stuff, particularly in relation to the environment. And the contrast with COVID is so interesting. Why did we respond to COVID in such a dramatic way, and we're not responding in relation to the environment equally? And the psychologist Daniel Gilbert has a really nice acronym, PAIN, pain. And we respond when a threat is P, personal. Very much when COVID came, it felt personal. We knew people who got COVID, or we might get it ourselves. When it's abrupt, PA, A is for abrupt. Now, COVID ultimately wasn't abrupt, but it felt abrupt when it happened. Like one day it came to us on an aeroplane from Italy. If you like, we even recast it as abrupt. So it felt abrupt. So PAI is immoral, which I will come back to because COVID doesn't quite fit that. But we also respond when something is happening now. The N is for now. So personal, abrupt, immoral, and now. And what's really interesting about COVID is we had this psychological tendency not to blame the virus for what was happening. We blamed the government and the media. We made it immoral. We over-attributed to the government as if they could have stopped it. So the difference between climate and COVID, it fits under those headings and maps perfectly onto the faulty alarm hypothesis. There's also the individual versus the collective interest. And I tend to get into trouble over this, as I undoubtedly will this evening, at public events where people will email me afterwards saying that by recommending individual action, we are removing sort of the impetus for political action. What difference can the individual make to the environment when politicians can make such a huge difference? And this is faulty reasoning, basically, and it maps onto the exhortation to register to vote and to vote, because collectively, obviously, we are all individuals acting in the collective interest. A disconnection from nature is also important, I guess, particularly in relation to food, but also other matters. And of course, simple denial and apathy as defences. When the thing we worry about is so big, we We just don't worry about it. So, what to do? I was told to be brief. I will. First, if someone has a frank anxiety disorder, if they're absolutely disabled by anxiety about the environment, obviously treatment is needed. However, the problem for most of us can be addressed much more simply by normalizing anxiety about the environment. In other words, trying to move it from pathological to adaptive. There is a lot to be anxious about, but we need to move from that being activating and not paralyzing. The best way to do this is by getting involved in one way or other in relation to the environment through personal actions and also collective actions. The big lesson from cognitive behavior therapy here is that if you're having lots of anxious thoughts about the environment, the best way to combat anxious thoughts is not necessarily with other thoughts. That can get really complicated. But first off, it's with behavior. Okay? Something called self-perception theory means we think based on what we do. So the best way to combat anxious thoughts is with behavior. So it might be making the kind of changes and moving more, as Janice was recommending. It might be making some of the dietary swaps or some of the other very achievable changes also recommended, or indeed, campaigning for the with regard to vaping and really activating politicians about that one, which is sort of one of the barn door things that they could push a lot harder than they're currently pushing. So it's the actions that matter. And as I suppose health professionals, we can contain people's anxiety, but also mobilize it into positive social change. And the results of this have to be measured in terms of the reduced emissions rather than necessarily reduced anxiety. There is a lot to be anxious about, in other words. What does getting involved look like? Changes in our lives. And this is incredibly important. So many people talk themselves out of changes in their own lives on the count of being one person in a very big world. But of course, if we all change, that is a big impact. And also there's spillover effect. If I do one thing, it's more likely my colleagues here will do it as well. So we are not just individuals when we make a change. We're part of systems, always. This can be in our personal lives, in our workplaces, or indeed we can take to the streets and protest in the various ways that we can. Work through our organisations. Anyone who has not been down to the Winter Hall here should take a look at the art exhibition on the theme of climate. And the college is, of course, publishing its climate position statement. Irish Doctors for the Environment are also doing an enormous amount of good work on this and going to make a lot of change. But ultimately, for big change, I'm really, really happy to see Janice's final slide. This is Rudolf Virchow here, a pathologist, physician, politician, who wrote medicine is a social science and politics is nothing but medicine on a large scale. We are very powerful indeed, and we can make dramatic changes. We saw it with COVID. And the interesting thing about COVID is a lot of people talk about its negative effects on mental health, and this was true. But in addition, there was an enormous amount of resilience, far more coping than you would imagine. And a lot of really, really constructive change happened. There was anxiety, there were increased rates of depression among certain groups, but overall, the effect was nowhere near as great as one might have imagined. And I'm not going to explicitly plug this, I'll just leave it here, coming out next week, a book about resilience and how the resilience that we saw during COVID can be harnessed for other things. We are stronger than we think, and wiser and kinder and smarter, and we can support each other with climate as we did with COVID. Thank you very much.